My name is Thomas Sumstein, and I'm certified to practice basic life support as an emergency medical technician in Orange County, California. In this video, I will be sharing what I've learned about taking vital signs without medical equipment. Emergency medical services professionals are trained to take vital signs with and without medical equipment, but it could be helpful if bystanders also had the skill to take vital signs without medical equipment. For example, if a healthcare professional asks a bystander on scene for more details, information provided by the bystander could help raise an index of suspicion for deeper underlying problems. A bystander who wants to assess vital signs should consider if doing so is safe, non-intrusive, and consensual. As a bystander, please only provide this information if a healthcare professional asks for more details. That way you won't obstruct their work. Let's talk about assessing level of consciousness. Level of consciousness has to do with somebody's awareness of their surroundings. And this can be assessed by asking a series of questions. 4 questions about 4 topics. That includes their name, location, purpose, and time. These questions could be phrased like this. What is your name? Where are we? Why have I been called here? What year is it? The answers to these questions are scored out of 4. The scale is called alert and oriented. So if a patient answers all 4 questions correctly, they would be A&O times 4. If they missed 1 question, if they didn't know what year it is, they would be A&O times 3. A score of less than 4 may be an indication of a deeper problem, such as head trauma or hyperglycemia. Let's talk about assessing a skin condition as an indicator of health. There are 3 major components to assessing skin condition: color, temperature, and moisture. Take note of when somebody's skin color is abnormal. If their skin is blue, it means they're not getting enough oxygen. If their skin is pale, that means they have poor circulation. An assessment of skin condition as pale, cool, and sweaty could indicate that somebody may be in shock. A patient in shock should be in a position of comfort, kept warm, and transported for professional help as soon as possible. Please consider having EMS meet you en route to an emergency room or urgent care. Let's talk about assessing somebody's pupils and their eyes. We use the acronym PEARL, P-E-R-R-L, which stands for pupils equal, round, reactive to light. If pupils are unequal and one is fixed in a dilated position, this could be an indicator that the patient has suffered head trauma and potentially brain damage. Let's talk about assessing breathing. We assess for respiration rate, rhythm, and quality. The rate would be the number of breaths per minute. The rhythm would be the consistency. Are there gaps in between breathing? Are there a lot of breaths followed by no breathing? Are there short breaths in between? And then quality has to do with, are the breaths shallow? Are they deep? Are they labored? Would it be considered agonizing for somebody to breathe? When assessing respiration rate, you don't have to count all breaths in an entire minute. Rather, count the number of times a patient's chest rises and falls within a number of seconds that you can easily multiply to come to 60 seconds. Example could be 10 seconds, 15 seconds, or 20 seconds. So let's try it together. Let's try to count respirations. I'm going to count the number of times that I breathe on my fingers while I'm counting to 15 seconds on my watch, and we'll multiply the answer by 4, and that is how we'd indicate respiration rate. Okay, so I got 4 breaths in 15 seconds. Multiply that by 4, that's actually 16 breaths, which is exactly the average for an adult. An adult normally breathes between 12 and 20 breaths per minute. The normal range for adolescents is between 12 and 16 breaths per minute. The normal range for children between 6 and 12 years old is between 18 and 30 breaths per minute. The normal range for children between 4 and 5 years old is between 22 and 34 breaths per minute. The normal range for toddlers between ages 1 and 3 is between 24 and 40 breaths per minute. The normal range for infants is between 30 and 60 breaths per minute. Be aware of different ways that breathing won't sound normal. These different ways could be snoring, high-pitched wheezing, low-pitched wheezing, and a crackling sound. If the patient sounds like they're snoring, that could be that there is an obstruction of their airway, or that their airway isn't clear. An obstruction could be their tongue that's preventing them from breathing properly. If there's a low-pitched wheezing sound, that could be an indication of asthma. If there is a high-pitched wheezing sound, or stridor, as we call it in healthcare, that could be an indication of an airway obstruction. So the patient might be choking on an object. If it sounds like there's a crackling sound when the patient is breathing, that could be an indication of fluids in the lungs. If that's the case, don't let the patient lie down, because the patient could drown in the fluids in their lungs. Let's talk about assessing circulation. This has to do with the flow of blood throughout the body, and indicators are heartbeat and pulse rate. We'll be assessing rate, rhythm, and quality. Rate would be the number of heartbeats or pulses within 1 minute. Rhythm would be how consistent are those beats or pulses. For example, is there a gap of no beats and pulses followed by a period of rapid beats or slow beats? Quality would be the strength or the weakness of the heartbeats or the pulses. I'll show you 2 convenient places to assess pulse. That's the radial pulse and the carotid pulse. The radial pulse can be found along your radius bone and then slightly inward towards yourself. About an inch inward. You want to use 2 fingers. How does that look with the camera? So you start from the edge, work your way in, roll the fingers down, and apply a little bit of pressure. You should be able to feel a pulse, and that is on either arm. That's the radial pulse. You do want to apply a little bit of pressure, not too much, because then you might cut off the pulse, but not enough pressure and you won't feel it. The other place to feel a pulse is the carotid pulse. That would be right around there. Not too far in the middle, not completely on the edge. It's closer to the edge. Maybe you start on the edge and roll in, and then drop a little closer to the middle, and then you'll find it, and it's along underneath the jawline by about an inch and about an inch down from the edge of the neck, and that could be felt on either side. To assess the pulse rate, you don't have to count for a full minute. You could feel the pulse and count the number of pulses for a number of seconds that can be multiplied to easily come to 60. Let's try 10 seconds, and then we're going to multiply the number we find, we're going to multiply it by 6. And go. Okay, so I came up with 15 pulses in 10 seconds. So that would be 90, a pulse of 90, which is within the normal range for an adult. An adult's normal range for pulses is between 60 and 100 beats. Children between the ages of 2 and 10 have a normal range of 60 to 140 beats per minute. Infants and toddlers between the ages of 3 months and 2 years old have a normal range between 100 and 190 beats per minute. Infants up to 3 months have a normal range from 85 to 205 beats per minute. So just to recap, it could be helpful for an emergency medical services professional to hear this kind of information from a bystander, but only if the professional asks the bystander. Normally, there's an operating procedure that the professional doesn't want to get distracted with. They don't want to get swamped with information, and they don't want their work to be obstructed. But in the case that they do ask a bystander, it could be useful for a professional to hear something like, if a patient has a pupil that's bigger than the other, that's an indication, that could be an indication that the patient has experienced brain damage. And then that would save the professional some time in acting accordingly. Another example of how this kind of information can save valuable time for a healthcare professional is if a professional asks a bystander for details and then they hear from the bystander that a patient has a low-pitched wheezing sound with cool, pale, and sweaty skin. This would raise the index of suspicion for anaphylactic shock. So that's it for this video. I hope you learned something useful. Hope it could be helpful to you and people around you, and I'll see you in the next video.